The goal of this module is to differentiate between training and education, review different theories of instruction and learning and their applications in the clinical setting, and to discuss the role of the clinical instructor in clinical education and training. Medical imaging and radiation therapy programs are very unique. Their curriculum is based upon science as well as art. The curriculum has a strong emphasis on science and mathematics, yet it also contains components of the humanities and social sciences. The developmental theory is based on the concept of mental models. Piaget believed that each individual experiences their own environments based upon their own mental models, and that these mental models are based upon repeated experiences and new experiences.
My greatest bit of advice for a new instructor would be to breathe. No instructor is perfect, and if you always try to be perfect, you'll fail. Don't measure yourself with educators who have many years of experience. Also, the students have more respect for a teacher who is honest and admits when they don't have an answer to a question, but finds out the information and relays that to the students.
Well, as Andrew says, at the beginning I probably did the same thing that a lot of my instructors did, but as time goes on you realize that you need to do a little bit more than that. And so I started going to seminars, talks, symposiums, talking to teachers, reading books, and getting some new ideas that I tried out on the students. One thing is to only do one new thing at a time so you don't overwhelm the students.
Well, I tend to be a visual learner, and so when I first started, that was a great strength that I had. And I've had to, through time, change my teaching to meet that need of the student because they're not all visual. Some are audio, some are tactile. So I bring different things to the classroom to try to show different methodologies or different ways of learning and to complement that. And it does have to change because each group has a different personality and different learning styles. So I agree with both parties that it's a dynamic process.
This concludes the sample of this module. Thank you for your interest in the Clinical Instructor Academy series.